Hi, I'm Steve Sellers, CEO of Premier Health, and I want to welcome you to our team. Our company was founded nearly 2 decades ago with the mission to provide convenient access to quality, cost-effective healthcare services to our patients, companies, and the communities that we serve. We accomplish our mission by focusing on 4 key organizational priorities. The first is patient loyalty. Our goal is to establish a bond with the patient that is so strong that it cannot be broken. The second is to be operationally efficient in everything that we do. Third, team member loyalty. We want to be the employer of choice in the markets that we operate in. And fourth, financial success. It's important that we continue to maintain a positive margin so that we're able to invest in the latest and greatest technology, equipment, supplies, and people. Each of us is responsible for maintaining a constant and never wavering commitment to providing the best customer service to our patients and companies that we do business with. Thank you for completing the orientation process. We look forward to you joining our team, and I hope to meet you soon.
I'm Elizabeth Perry. I'm the Human Resources Generalist for Premier Health and all of its affiliated entities. So you are in new hire orientation, and these are a few of the items that we're going to be discussing today. We have a little bit about Premier Health, who we are, and what we do for you guys specifically as an employee. We have our company overview, our affiliated clinics, our mission, core values, and then from human resources standpoint, which is what we're really going to focus on today, as far as the policies and procedures, ultimate software, payroll, as well as some benefits. That might be specific to not only our full-time employees, but also our part-time staff as well. We'll go through some operational efficiency, the initial login process as you go through the systems in our clinic. We have quite a lot of systems when you get really familiar with the clinic and the processes. So I'm going to go and walk you through that process as you log into each of the different systems. We're going to go through a little bit of customer loyalty and building customer trust with our patients. Then you'll go through a quick regulatory overview that focuses on the compliance side of things, from compliance and integrity, our code of conduct, the compliance certification process, culture diversity, civil rights, and non-discrimination processes as well. Then we'll go through some HIPAA with PHI use and disclosure, the employee HIPAA and confidentiality acknowledgement, and then finally we'll close off with some OSHA regarding the safety emergency preparedness processes, fire safety, hazard energy, hazard communication, OPIM, and bloodborne pathogens. Then we'll have the safe work practices and go through the full entire employee incidents process. So you might be wondering who Premier Health is. So we partner with various health systems, hospitals, and even physician groups across the country to provide an extension of cost-effective healthcare services in an urgent care delivery model. This can also be through occupational medicine that we offer as well for our clinics, but mostly we are considered the experts in urgent care services. So we have a full team in place. We have our medical directors, physicians, nurse practitioners, and physician's assistants. The great thing about our company and our clinics across the country is that our medical directors are actively working in the clinics with you guys. So they're getting hands-on in the trenches with you in the clinic, so they're able to report back to us on processes that need to be changed specific to those clinics that they're working in. We also have healthcare administrators. They're over the entire region or the specific entity, so they're going to help with the overall operations of the clinic. They're going to work very closely with a lot of our other managers in the facility as well to get a real good overview of the actual clinics in and of itself. We have our clinical compliance team. We're all really housed here in Baton Rouge, Louisiana in our corporate office. They're here as well, and they monitor the day-to-day operations of the regulatory and compliance processes with our clinics. For site managers, those are specific people that are assigned to each clinic. So they have a home clinic, they're concerned and focused on that specific clinic. They manage the day-to-day operations there, as well as any ordering processes of equipment, supplies, really anything that is tailored to that clinic. In the event that an employee is not able to get to their shift on time, that site manager is responsible for making sure that shift is covered at that clinic. Then we have a full marketing and business development team. This is one part of our company that works very closely with the people that we have partnered with. So the health systems and the hospital groups, they work very closely with those marketing individuals as well to make sure that the marketing processes are the same from health system to the urgent care center. So we provide that same standards of care. We have a finance and accounting team. We have our HR team. Our information technology or our IT team also housed here in Baton Rouge, Louisiana. They're able to log into any of our computers across the country and fix anything that you guys may need. So it's a quick email or a phone call to our IT team and they're able to really fix just about anything from Baton Rouge. So it's very convenient. We have our managed care and credentialing team also here in Baton Rouge. If you are a provider for our company, you will go through that very lengthy process here in Baton Rouge. The only other team we have here is the Revenue Cycle Services. That's our billing department. The great thing about our billing team is that everything is done in-house. It's here in Baton Rouge, so if a patient has an issue with their bill, they're able to pick up the phone, they're gonna call this phone number here in Baton Rouge, but they're gonna be immediately connected to a live person that's here, so they're able to have their issue fixed immediately. The great thing for our customer service representatives is that they're able to be connected with a billing person that's specific to their entity to go through any coding questions, verification processes directly with a live person here. So it's very beneficial not only for our patients but also for our employees working in the clinic. So these are our affiliated entities across the country. The things that are in the West, those are actually consulting projects that we've actually closed out. So we've gone in, we've helped a company open up an urgent care facility, or maybe an urgent care center wasn't doing too well, so they called on us to turn things around for them. So we have done some consulting projects in the West, but as you get into the East, you can see we have a lot going on right now. Most of our clinics are based in Louisiana, mostly being in Baton Rouge at this time. Lake After Hours is our first clinic that we opened 17 years ago. With Lake After Hours, we partnered with Our Lady of the Lake Regional Medical Center here in Baton Rouge to open up those clinics. We then opened up an occupational medicine clinic, which is down in Baton Rouge as well. Then we have LSU Health Baton Rouge, where we actually only manage the providers at that facility. So we don't have any ownership in that company. That is solely owned by Our Lady of the Lake, but we do manage the providers that staff that facility. We have Lake Urgent Care, that's out in Ascension Parish here in Louisiana, where we've partnered with St. Elizabeth Hospital to open up clinics there as well. They have 4 clinics. We have Lake Urgent Care North Shore. That is 100% owned by Premier Health. It's a clinic in Covington, Louisiana that we opened. There was a need there, so we went ahead and opened that clinic. We have Riverside Urgent Care, which is on LaPlace, Louisiana. We've partnered with Dr. Chris Swearingen to open that one facility there. We have Total Urgent Care and Occupational Medicine that is in Cutoff, Louisiana, and that is again solely owned by Premier Health. We have Lourdes After Hours, that's in the Lafayette region. We've partnered with Our Lady of Lourdes Regional Medical Center to open up 3 clinics there with the 4th one on the way. We have Lake Charles Urgent Care, where we've partnered with Dr. J. Mark. In Lake Charles, he has several clinics that are operating with more to come in the future. We have Rapides Urgent Care. We have one in Alexandria and one in Pineville. We've partnered with Rapides Regional Medical Center. For St. Francis Urgent Care, we've partnered with St. Francis Regional Medical Center to open up one urgent care center there. We have St. Vincent's Urgent Care, which is in Birmingham, Alabama. We currently only manage that facility, but we are looking to partner with them where we will open up more clinics in that area if that partnership does come about. We have IU Health Urgent Care. That is one of our biggest projects. You'll probably hear about that a lot in the clinics. We've partnered with Indiana University Health System, and they would like to open anywhere from 15 to 20 clinics within the next 5 years. We have been partnered with them for a little over 2 years now, and we have 5 clinics. We just opened the 5th one in July. We're set to open the 6th one this winter. So they are coming very quickly. And so you'll hear a lot about that when you get into the clinics. We have Pardee, where we've actually had a physician's assistant that went up there. We consulted with them to actually help them turn their clinic around. Then the last one is Premier Medical Center. That is in Puerto Rico. So it's down here, you can see right below Florida. and we are set to open up that one this fall. The great thing about our clinics is that they are all accredited by the Urgent Care Association of America, or UCAOA. So what does that mean specifically to you as an employee? The great thing is that this means we have standardized our care across the board. So if you work here in Louisiana and you turn around and you want to go to Indiana and you want to work there, you can, because it's the same processes. It really goes across the board along everything. The only difference is we may have a change in supplies, equipment that might be used, but the processes are going to be the same for your job discipline. So really great opportunity for our employees to move from company to company. What it means for our company in and of itself is that we have met and achieved excellence in all of the areas listed here, from governance to our scope of care. So the UCAOA team came down from Chicago and they tested us on these items. They wanted to know everything, pulled back the curtains, asked our employees questions, asked patients even questions about our processes, all the way from governance to scope of care. And like I said, we went through this testing phase and we achieved excellence on our first try. So all of our centers were accredited, and not only that, but the centers that we open from here on out will be accredited by the Urgent Care Association of America. Also, our president and CEO of Premier Health sits as president of the board for UCAOA. So our company mission is to provide an excellent patient care experience through convenient, quality, cost-effective healthcare services. We will strive to be the premier urgent care and occupational medicine provider to those we serve. So we accomplish our mission through our core values: customer loyalty, employee loyalty, and operational efficiency. So our core values are service, integrity, quality, and respect. So through service, we will service our community with skill, concern, and dedication. Through integrity, we will conduct business with the highest ethical standards. Through our quality, we are committed to achieve excellence in everything that we do. And with respect, we recognize the value, diversity, and importance of each other and our partners. So for scope of services, we have urgent care situations versus emergency situations. So you can see this list here. We also have this in each of our clinics. However, it all depends on the provider that you're working with in that given shift. So we have providers that come to us with all different backgrounds. Some have emergency room backgrounds, some have trauma backgrounds, some have been primary care providers for years. So it really depends on what they're comfortable seeing and treating in the clinic, on what the services that you'll be providing on that given day. These are our typical urgent care situations, and these are our typical emergency situations. The great thing is that we have a fantastic referral process with all of our clinics, where if we have this emergency situation arise, we can refer our patients out to the emergency room. In some of our clinics, we're able to bypass the wait time where they're immediately seen in the emergency room. We also have referral processes set up with orthopedists and different cardiologists throughout the area as well. So again, it all depends on the entity that you're working with, but if there is an emergency situation, we have the ability to get our patients to where they need to be in a timely manner. So getting into the human resources side of things, these are going to be your requirements as an employee. It is going to be your responsibility to maintain your licensure as required by your professional job discipline. And we ask if you make any changes or updates to any of your licensures or certifications, that you send a copy of the updated certification to us here in Human Resources. So in your packet, you'll receive your new hire training checklist, which you'll be required to take to each of your training shifts from here on out. Your preceptor that you'll be partnered with on day one of your training clinical shift will eventually sign off once they feel like you are competent in the areas that are listed on your checklist. So in a year from now, from your hire date, you will go through an annual training. These trainings typically occur in June and July, so depending on when you're hired will depend on when your actual annual training, if you'll need to go through annual training or not. So you'll complete this annual training. It's a skimmed down version of your new hire training checklist. It takes about 2 hours to complete, and as I mentioned, it'll be in June and July of each year. That's typically our slow seasons in our clinics. Then during the month of your birthday, you will be required to complete an annual TB skin test and/or the TB questionnaire that you received during your new hire processes. This will be decided again based on the month of your birthday. If you have a separate schedule, maybe with your full-time job, you're able to keep that schedule as well. We just need to make sure that it's updated on an annual basis, and those updates are sent over to us in Human Resources for your employee file. You will have yearly evaluations completed by your direct supervisor. They will set that time up with you once you've met that annual requirement. So some specific policies and procedures that we're going to go over in Human Resources. When we get to the compliance and regulatory section of our presentation, you'll actually learn where to access these policies and procedures when you're in the clinic. So specific to Human Resources, you are employed at will. You can come and go as you please. As a provider with our company, you will need to provide us with a 4-week notice of your termination. For everyone else, it's 2 weeks notice of your termination. If you don't give us that notice of termination, when your paperwork comes over to us in Human Resources, we will have to check that you are not eligible for rehire with our company and its affiliated entities. So specific to dress code, we ask that you reference the email with specific uniform guidelines that was sent out to you from Human Resources. That will give you specific rules and regulations for your uniforms at your specific entity. You will receive your employee badge, and once you receive that badge, you'll be required to wear it for each of your shifts. It is just an identifier of who you are with your picture, your name, and your job discipline. There will be no facial piercings or visible tattoos, so all facial piercings must be removed. You cannot wear clear plastic holders in those piercing places. It has to be completely removed. For visible tattoos, we ask that you cover them, whether it be with a jacket or a long sleeve undershirt under your scrub top. That is all dependent on the colors. Again, you should reference your uniform guideline to see the specific requirements with color of jacket as well as the color of your undershirt. We ask that you be in assigned uniforms at all times. We expect for you to conduct yourself in a professional manner. We are a drug, alcohol, and smoke-free workplace that also includes our campus. So if you need to leave to take a smoke break, you actually have to completely leave our campus. You just can't go and sit in your car for that time. You have to actually completely leave the facility. For social media, there are two sides of this. There's the employee side as well as the employer side. So from the employee standpoint, please be mindful of what you post on social media, especially if you link us as your work location. Nothing about patients, even if you don't list their name or any kind of personal identifier. Please just say nothing about our patients. Make sure you keep work and personal life separate. That's your best bet. For the employer side, some of our clinics, we actually do have social media pages set up with the ability for our patients to make reviews on their experience. So please just be mindful that if you see a patient that seems to be upset before leaving the clinic, try and ease the situation as best as you can. If they're upset about a bill or whatever the case may be, simply offer them the billing number so that you're giving them the next answer, somebody that can help them with their problem if they can't fix it themselves. Excuse me. We have a zero tolerance policy for harassment, and we ask that you report any instance of harassment so that we can prevent that hostile work environment. For attendance, we ask that you be present and on time for all of your shifts. Accessing and securing the facility, the providers and/or the site managers are going to be responsible for accessing and securing the facility each day and night. For schedules, your supervisor will provide you with specific guidelines for scheduling processes at your specific clinic. So just be mindful of that. They're going to be in contact with you after you complete your orientation to set up your initial scheduling. Once you get into the clinic and get familiar with everything, they're going to go through how to schedule from there on out. In the instance of an emergency, say you can't make it to your shift, we ask that you first call your direct supervisor because they're going to be able to better guide you on who you should contact and what you should do. They may have a list of employees that are looking for additional hours, whether they be part-time or PRN status, so they can guide you to the person that can best help you in this emergency situation. For employee parking, we do have designated employee parking areas. We're not going to require that you park there on your first shift. It can be very overwhelming, especially if you move from clinic to clinic. We just ask that you park in an area that avoids the spaces near the patient entrance as well as the ambulance entrances. Those are clearly labeled on each of our clinics. So for clocking in and out, We have time clocks in all of our facilities. They're typically housed in the break room or right outside the break room in the hallway. You're gonna first enter your employee number at that time clock. Your employee number is gonna be the last 6 digits of your Social Security number. If the last 6 digits start with a 0, you're only gonna use the last 5. So in this example, this person's last 6 of their social is 0, 1, 2, 3, 4, 5. So when they walk up to the time clock, their clock in number is actually only gonna be 1, 2, 3, 4, 5. Then you're gonna simply press enter. You'll do the same thing when you clock out. You're gonna walk up to the time clock, enter the last 6 digits or the last 5. If your last 6 starts with a 0, you're gonna press enter. That's gonna clock you out. It's a very easy process for clocking in and out. If the power's down or it doesn't look like the time clock's turned on, you can still enter in your number and it should hold it in the time clock. So if the power does come back or the time clock comes back on, it will be sent off at that point. So all of the information that you've sent to Human Resources through the onboarding process, as well as your clock-in information, payroll, and benefits, that's all going to be housed in Ultimate Software, UltiPro. That is our Human Resources online software system. It is web-based and can be accessed from your home computer, your tablet, your cell phone, desktop, whatever the case may be. It can be accessed from any electronic device that has Wi-Fi capability. So to log into your UltiPro, you're gonna visit the website ew22.ultipro.com. You have to type in that EW22 to get you to the Premier portal. So you'll go to that website, you're gonna enter in your username, which will always be PHC, your last name, and then the last 6 digits of your Social Security number. Your temporary password is going to be your birthday. It's gonna be written as 2 digits for the month, 2 digits for the day, and 4 digits for the year. Then you're simply gonna press login. You're gonna then be prompted to authenticate your device. So it's gonna look like this. It's gonna ask you for a delivery method. How do you want that 5-digit access code to be sent to you? We're gonna go ahead and plug in your email address as well as your phone number when we put you into the UltiPro system. So it'll have your phone number as well as your email, and you're able to select that delivery method. If you want it to come to you through text, through a voice recording, or they can email you the code. You select your delivery method and press submit. Then it's gonna ask for you to enter that access code. Again, it's 5 digits. You have 5 minutes to enter that code. You're gonna type it in where it says enter access code here. You can check the box that says do not ask me for codes again on this computer for the next 30 days. However, if you change your device, it's going to continue to ask this code. So again, if you move from your laptop to your cell phone, it's gonna ask to send this code each time. This is an extra security feature that we have put in place for UltiPro, and this is just to make sure that it is you logging into your account each and every time because we have so much of your personal information housed in this system. So again, you'll enter the code, you're gonna press submit. When you first log in, it's gonna ask you to set a permanent password and answer a few security challenge questions, but then you'll eventually get to your home page. So this is what your home page will look like. It'll have your name with your title listed as well as your badge picture. You'll have your last pay statement available for you to view. You can download, save it to your computer, or print it right from there. We do not mail our pay statements out because you can access them online 24/7. So you can view your pay statement right there. You can go over to direct deposit, view your current bank account that you have set up. In UltiPro, you can make changes to that account, whether it's how your money's being deposited to your checkings or savings, or if you need to change your bank, you can do that as well through the direct deposit icon. Your contacts, that's gonna be your emergency contact as well as your dependents or beneficiaries. That information will be plugged in under contacts. You can make changes to that as well. Your name, address, and telephone number, you can click on that box, it'll pull you to all of that information. You can edit that information there, and then you can set goals for yourself. You and your manager can work on that, and you can set goals in UltiPro and they'll be housed in the system. You can make edits to all of this information at any time, however often you would like. It's gonna come to us in Human Resources for approval to make sure it is you making these changes, but it's a quick fix Once it comes over to us that you've made the change, we can typically verify it right away, make sure that it is you. If you're changing your name or specific direct deposit information, we're gonna reach out to you for additional information, whether it be a license or social security card and a reason for the name change, or if it's specific to your bank, we need to make sure we have the proper banking information and it's you that you've added that bank account. If you go between each of the sides here, we have these arrows on our UltiPro page here. You can see if you toggle between these black arrows, it'll take you from your UltiPro homepage to your UltiPro news page. So on the news page, we're constantly updating this, a lot of times with benefit information. We've updated with 401k notices, specific to your health insurance plan. We also update with a lot of compliance things that are coming through that we need to send out to our employees. We do have our HR and payroll contacts. You can press on the More tab and it'll drop down all of our contact information with our direct lines, our email addresses, and what you can contact us for. All of that can be accessed there. So you'll see at the top of your page, you're gonna have these green tabs. On an employee, you're really only gonna have the Request Myself and My Company tab. All the other tabs that you've seen here and before, that's for a human resources employee. But you'll have Request Myself and My Company. Under the Request tab, you're really not gonna do anything. We have our own email system that we use our requesting processes through. On My Company, you can hover over that, click down, and you'll pull up an employee directory, so you can search for any employee in the company. Say you want to look for somebody with the last name starting with P. You can go to last name, press P, and it'll pull up every single employee that has the last name starting with P. All of our employees are set to private. If you go into your UltiPro account, you can make your contact information public. At that point, employees could view your information publicly, whether it be your phone number or a secondary email address. But you're gonna spend most of your time under the Myself tab. We have the personal information plugged in on the first column, so your employee summary, which has name, address, and telephone, your status key dates. So a lot of employees wanna know what's their hire date. It's the day that you do orientation is your hire date. So that may be something that you forget later down the line. No problem, go to status key dates, it'll pull it up for you. Your contact information can also be checked here. Your private information is going to have your social security and date of birth. Identification documents, we don't really house them on UltiPro, we house them here in our company files, but we could have the option to put it there as well. Under jobs, it's really important that when you first log into UltiPro, you check this, make sure all this information is correct. Your job summary, what your job title is or your job discipline is listed correctly, your compensation is correct. Sometimes we have managers that speak with you privately about additional compensation processes that might come to us directly. So you just simply let HR know if the compensation does not seem right, and we're able to meet with your manager and make that change if needed. Okay, so be sure to check that information. Under career and education, again, you can set goals and type in your personal information here, add your talent profile, some personal development processes. We're gonna plug in your licensures under licenses, and we're gonna plug in your drug screen and TB test under the test portal. Under pay, you'll see current pay statement, pay history, year-to-date, direct deposit. All of that can be viewed there. So your pay history, that'll be from the first paycheck you receive from 10 years from now. So you can constantly see your pay statements, print them, save them as you need them. Your year-to-date summary, that's gonna give you a snapshot of how many hours you've worked year-to-date, as well as the amount of money you've made, also the amount of taxes you've paid out, and for the benefits side of things, if you're full-time with us, you'll see a screenshot of how much you've paid into our benefits. Again, you can access your direct deposit information here, make changes as well. For income tax, you can see your tax withholdings for state and federal requirements, and you can make changes to those at any time, however often you would like. When tax season comes around, you can print your W-2 straight from UltiPro. We will mail those out to each of our employees. If you need it before the time that we mail it out, you can go ahead and print it straight from here. For benefits, if you're on full-time with us, you'll be able to readily see your current benefits listed under the current benefits tabs, as well as your beneficiaries and dependents. If you need to make any changes to that, it's actually gonna have to come through me, and we can make changes, fill out any necessary documentation. For the Life Events tab, that's actually going to be how our full-time staff enrolls in our benefits, is through that Life Events tab. So you'll simply click on there, press that you are a new employee, and it'll take you through each of our benefit plans. It's a very easy process. Everything's already pre-calculated for you because your salary and your age is plugged in there, so you're able to see how much you'll be putting into each of our benefit plans. You can make changes throughout the Life Events, all the way until you press submit. Once you press submit, if there are any additional changes that you would like to make and it's before the due date, you can simply just reach out to me and we can make those changes right away for you. But one thing you're really going to want to focus on is that time management under the second column there that's highlighted. So if you click on time management, make sure your pop-up blocker is turned off, then your time card will pop up and appear. If you have a red square on your time card, that indicates that you have a missed punch. So it's very important that you let your supervisor know of a missed punch on the Monday of pay week by 12 p.m. I encourage all of our employees to send an email to your direct supervisor in regards to this missed punch. That way you have a time-stamped document stating that you have turned in this missed punch before the required deadline. If you're a provider, it's important that you contact our payroll specialist, Tashika Robinson. We have her email listed there, and she will be able to fix your missed punch before the deadline. So specific to payroll, we are paid on a bi-weekly basis every other Friday. So again, the Monday of pay week that you're to be paid that Friday, you should let your direct supervisor know by 12 p.m. on Monday. Your checks are going to be issued via direct deposit, and as I mentioned, you can see that information on UltiPro and make changes there. As I mentioned, you can update your UltiPro at any time, however often you want. These are a few items you can change, but we've gone through the many different areas that you can change. We will be required to withhold state and federal taxes. You can make changes to those tax withholdings in UltiPro at any time. We will be subpoenaed to withhold garnishments, child support, and IRS levies. For employee benefits, our full-time employees are eligible to receive our health insurance, which is currently through Blue Cross Blue Shield, our dental insurance, which is through Principal, our vision insurance that is through Principal, but it's a product of VSP, our voluntary life insurance through Principal, and our voluntary short-term and long-term disability through Principal. The great thing about our new employees is that you are currently in what we refer to as open enrollment. So you are able to access any of these plans, no questions asked. They will be effective on your benefits effective date. Once you get into open enrollment, if you have waived all of your coverage at your new hire period, you will have to go through a process where the vendor will actually have to approve your effective date for your coverage. We do offer supplementary insurance plans through Aflac. You will receive paid time off and paid holidays if you work at least 36 hours per week. For 401k, all of our part-time and full-time employees are eligible to start contributing to our 401k plan after 90 days of employment. So you have received the nationwide enrollment book. At 90 days of employment, you can go ahead and flip to the back of that book starting on page 50, and we actually have the enrollment forms for you to fill out, and you simply fill out those forms and return them to me. You've also received a summary of service providers document. On that document, it has Horizon Wealth Management. They are our financial advisors that are free of charge to our employees. So you can reach out to them, their phone number is listed on that sheet, and you can contact them about any specific investment options and really kind of just get familiar with our 401k plan. They'll let you know if they think it's a good idea for you to invest in our plan and what you should do with previous funds if you have a separate job or another 401k plan. Once you have made 12 months with us and you've worked at least 1,000 hours, Premier will start contributing to your 401k plan, and they will contribute up to 3% of your annual salary each year. So something very beneficial for you to look into, especially as you start the process and the hours worked. So some of our part-time employees do qualify for that 1,000 hours requirement where they're able to have Premier Health contribute to their 401k plan. Your benefits will be effective the first of the month following your 30 days of employment. So you'll hit your 30 days of employment, and then the first of that month thereafter, your benefits will become effective. If you need to make any Additional enrollments or changes to your plans, that can occur during annual enrollment, which is typically during October or November of each year. Those plans will then be effective January 1 of the following year. So you will receive a document that has initial logins for new hires. This is going to be the document that really guide you for all the systems that you're going to go through. You'll have your company email. You'll receive an email from our IT team. It's helpdesk@phcurgentcare.com. In that email, it'll have the setup processes for setting up your company email address. You're going to visit the website apps.rackspace.com. Your username is going to be your first initial and last name @phcurgentcare.com. Again, your username could be different depending on if you have a common first and last name. There may be a number behind that. So it's very important that you check that personal email address that you've provided to us to make sure that our IT team has sent that information over. Your temporary password for your company email is going to be Premier1 with a capital P. Once you get into your company email, you're going to have the login information for all of the other systems that are listed on the initial logins page. You'll have My Premier Schedule. If your entity uses the company scheduling system, that information will be in that email. Your DocuTap training, the information that's provided on the initial logins for new hires, you can access your DocuTap training right now through that login information. It's the same for each employee in our company. For DocuTap, you'll receive the login information in your company email. You won't be able to log into DocuTap until you get into the clinic because we do have patient information in there, but you will have your username and password. Once you get into DocuTap for the first time, you'll be required to set a permanent password. It's very tricky. It has to be 8 characters, 1 capital letter, 1 number, 1 special character like an exclamation point. It can't be connected to you, your name, or your date of birth. So be thinking of that because it will lock you out after a certain amount of tries. Then you will also have your Litmus login information. Your username and password will be provided in your company email address that comes to you once you get logged in through there. Once you get into Litmus, you'll be required to complete additional training. That's going to be your OSHA, bloodborne pathogen, and HIPAA training. That's specific to what we went over today, so an orientation. For you to start in the clinic, you need to complete those 3 trainings. It's very important that you do it as soon as possible. Litmus as well as UltiPro will be available to you within 48 hours of you completing your orientation. So very important that you log into Litmus, also log into UltiPro to verify your information, everything's correct before you get into the clinic and start training.